Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
histopathological report. So you are
In endometrial hyperplasia, after doing endometrial biopsy, we subject the sample to histopathological examination. Then in the histopathological examination,
you have to take endometrial biopsy, and on endometrial biopsy, on histological examination, you will see histopathological report. In histopathological report, you will either see endometrial hyperplasia. If on histopathological report, if you see there is endometrial hyperplasia without atypical cells, that is, if it is it can be simple endometrial hyperplasia without atypical cells, or complex endometrial hyperplasia without atypical cells. If it is simple endometrial hyperplasia without atypical cells, there is 1% chance of malignancy. If there is complex endometrial hyperplasia without atypical cells, there is 3% chance of malignancy. In this case, the patients are treated with progesterone. Progesterone can be given either cyclically, that is 14 days in every cycle, or continuously with the help of Mirena intrauterine contraceptive device. So overall, Mirena intrauterine contraceptive device is preferred. Cyclically, oral metroxyprogesterone acetate can be given. After 3 or 6 months, repeat the endometrial biopsy. Endome-
thank you and thank you for watching.